We are back on MorningLine. Our guest in our final segment here, Dr. Katrina Green. She's an emergency room physician. Appreciate her coming on. Thank you for coming on, doctor, this morning, reminding folks that you're joining us on Zoom from your home. You have a mask on. Obviously, you advocate for masks, but typically you would not be wearing a mask at home. But your husband has COVID. He's recovering, and that is why you're having it. A lot of people noticing that. And I want to explain that to him. And she's not fear-mongering and wearing a mask on air just to make a point. She's wearing it because she wants to stay healthy for her job, of course, and her husband is home with her right now, who is fighting COVID. Let's go. Another phone call is going next to Drew. Drew, good morning. Hi, Drew.
Hi, Nick. How are you today?
Hey, what's on your mind?
I just have a quick question. Do you think it's harder? I know the doctor says it's pretty easy for people to get help in Nashville, but how about the people in the outlying areas that are suffering from immune compromise and mental health, especially anxiety? I think if you're suffering from anxiety, this pandemic's been wreaking pretty bad havoc on you.
Okay, thank you for your call. Well, doctor, you work in the Nashville area and you also work in a more rural area down around Lawrence County. I don't know if you have any thoughts on that. He was talking about anxiety as well as maybe getting the help for COVID and the like. What do you notice about rural areas in your experience?
I've definitely seen an increase in the patients with anxiety issues coming to my emergency department for help. And, you know, it has to be related to what we're all going through. This pandemic has been going for a year and a half, and it's affecting us all deeply on a deep emotional and mental level. It's affected me too. It's affecting everything we do. You know, my husband commented recently that all I talk about is COVID anymore. I'm like, well, that's my life. You know, that's all I do, all I see in the ER. That's all that we're hearing on the news. And so when you're constantly bombarded with this pandemic, it's understandable that someone would be having some mental issues. And on that note, I would like to say to our listeners and watchers at home, if you're having issues mentally, if you're feeling depressed, if you're feeling suicidal thoughts, it is very, very important to seek help for that. My emergency department and all emergency departments are open 24/7. We are there to help you get through any mental crisis or physical crisis that you have.
Thank you for saying that. Let's go next to Katie. Katie, good morning. Hi, Katie.
Hey, how are you guys?
Good. What's on your mind?
I was just curious. This is so funny because I actually have anxiety too, taking new medications, and that's one of the reasons I have not gotten the vaccine yet. I schedule an appointment and then I freak myself out and I don't go. So my fear is if I go get the vaccine, what happens if I come in contact with the virus, you know, before I can get my second dose and my body's building that immunity? Is it going to cause my body to like go into like that hyperinflammation process when I get COVID, if I get it before I can get, you know, fully vaccinated?
You know what? It's interesting you would say that. I appreciate you calling in, and I hope you go get vaccinated. Some of those same thoughts went through my mind initially, and I've gotten both my shots months ago. But I think that's fair for her to say that. It sounds to me, here's a woman who I think is ready to get the vaccine, but still has some apprehension about that first shot and what happens between that and the second. Why don't you walk her through exactly how that works?
Right. So when you get that first shot, your body looks at, you know, that mRNA protein that helps your body develop antibodies. And so that's your body's first interaction with anything related to the virus, unless you've had COVID before, of course. So when you get that first vaccine, your body's, you know, going, that's something new. Let's look at that and figure this out. But the antibodies that you develop from that don't completely protect you until you get your second dose. You're maybe about 20 to 30% protected from what I've read in the studies from the first dose. The second dose that you get 4 to 6 weeks later, depending on which vaccine, is what really ramps up your immune system to say, okay, goodness, this is really something I need to be concerned about, and make a bunch of antibodies. So your body goes into like antibody production. I don't want to say overload, but you know, I'm not an immunologist, but it goes to work. to protect you against the virus, should you see it in the future.
Yeah, so she should
You need to mask up.
Yeah, mask up, and she should not be concerned with it. And I would say, if you just want to look on the other side of the coin, Doc, I guess, it's that right now she's unvaccinated and she's vulnerable. That first shot immediately gives her some protection, and the second one even more. So whatever concerns she has coming, as she sits right now, she's exposed. And so if you're open to the vaccine, which is safe, look, I've had it. I don't have a computer chip I don't have metal sticking to my head because I've been magnetized or any of these silly things we've heard about. Katie, if you're really open to it, go get it. Don't walk away. Trust me, you're going to be fine. Let's go next to, and I'm not a doctor, but that's what this doctor would say. All right, let's go next to Jacqueline. Jacqueline, good morning. Hi, Jacqueline.
Hi, Jack. Hello?
Hello, go ahead, ma'am.
Well, anxiety, that messes up your immune system as well.
Mm-hmm.
So when you get to worry about this vaccine, this COVID-19 and all, it goes, your immune system goes down when you stress about it.
Yeah, well, it's true. Anxiety. I don't know if she means you have anxiety over the shot, but, I'll tell you where my anxiety was. Waiting until I could get that shot. I had anxiety because I wanted the vaccine and I felt exposed. So, yeah, in general, however you feel about it, and there's obviously a lot of people right now that still have questions and are not vaccinated for whatever reason. But anxiety can reduce, your immune system, can it not? I mean, if you're worrying all the time and the stress.
Right, exactly. So constant periods of stress have been shown in scientific studies to affect the immune system. And I think this pandemic is the definition of a constant period of stress on most people's bodies. Mm-hmm. So that may be affecting people's immune systems, and the best way to protect yourself is to go ahead and get that vaccine.
Gotcha. Let's see. Let's take a call next from MJ. Hello, MJ.
Hey, good morning, Dr. Green. So good to hear you speak on so many issues. I'm curious, as a community member, what you feel we can do to support you on the front lines. It's truly a battlefield condition with patients just not taking vaccines, over cautious communities, under masked and under vaccinated. How can we help you as a frontline warrior in this battle?
All right. Do you have any suggestions?
Right.
And thank you for your call.
Yes, thank you, MJ. So the best way you can help a frontline healthcare provider right now is to get vaccinated. That's the number one thing we're asking the public to do, is please help us help you by getting vaccinated. The second thing you can do is to wear a mask when you're indoors, in public, and in crowds, because that will help keep the virus from circulating as much as it already is. And that's really all that I can ask you to do. I hope people listen to that. I am very encouraged that more people seem to be getting vaccinated, and we just need to all do our part. We're in this together. So please get that vaccine and wear your mask.
Real quick, we'll try to squeeze in one more call if we can. James, go ahead.
Yes, my brother is a Berry Hill police officer, and he was required to get the vaccination. His daughter went to school, got the COVID, and brought it back home, and he still got the COVID. So why is that after he had the required vaccination?
Okay, and a lot of people say, hey, I got the vaccine. It must not work. I still got it, or we see these breakthrough cases. Maybe you can just briefly, we only have about a minute, explain why that can happen.
Right. So anyone who gets infected with COVID can develop this long COVID syndrome that we're still learning more about. We don't know everything about long COVID yet. It's a new thing. But vaccinated people, from what I've read, the studies that I've seen, are less likely to get long COVID. Now, that doesn't mean that they don't get it. And I'm very sorry that your loved one is dealing with that. But had he not been vaccinated, it might be worse. So vaccines prevent you from getting severely ill, from dying, from needing to be in the hospital. And we think that vaccines do provide some protection against long COVID as well, but the science is still out on that.
Okay, yeah. So the reminder is for folks that you could still get it. And I've talked to several people who said that they were a breakthrough case. And there's not a ton of them, but a breakthrough case, doctor. And they more or less said it really scares them to think what it would have been like with the symptoms they had even with the vaccine, which, by the way, are pretty awful still. I mean, you don't want to get sick like that, but that without the vaccine, I've had a few friends tell me that they worry that they might have ended up on a ventilator just based on how bad their reaction was just with the vaccine.
Right. And so, like, that's what I've been saying. Like, get vaccinated. It will prevent you from getting severely ill. If you catch COVID, you may still get symptoms. They might be mild. They might be not mild. You might have moderate to severe symptoms, but being vaccinated does provide anywhere between 90 to 95% protection, depending on the vaccine, of keeping you out of the hospital when you're sick from COVID.
Gotcha. Hey, Dr. Green, thank you so much for joining us this morning, and I really appreciate you coming on, telling it like it is, folks, if you dispute some of what she says, just remember what she did say. She's a doctor, and she wants to do and use everything in her power to help her patients get better. And I believe you when you say that. And I do hope your husband gets better as well. So thank you for joining us today.
Thank you so much, and thank you for having me.
My pleasure. All right, listen, we'll take a break, and thank you to Dr. Green. We'll come back with a programming note about tomorrow right after this. Stay with us.